Good afternoon. Welcome to Neetu's Academy Reading Live. I am Vinod James. Hope you had a lovely 2 days of break without me in front of you. Yes, did you? But I'm sure that you're all lovely students who have been practicing, and a lot of students have taken exams, and which we could see when you were all attending Neetu Madam's live. And I was told that all of you have been doing the exams very well, or have done the exams very well. Sorry. Okay, so it's quite nice to hear that, and what else could we ask for, isn't it? As long as you're all doing the exams, doing the materials proper, feeling that the exams are all getting like more easy for all of you, and you're all confident with your exams. That's the utmost important thing for us. So once again, I am Vinod James. Welcome to Neetu Academy Reading Live. No matter wherever you are, whichever part of the world you are from. Now, why whichever part of the world? Because we have students from different parts of the world. You name Ashita Tulasi, right? We have students from different parts of India. Of course, we have Manisha Sunil. Hi. Shobika, yes. Vandana, okay. Hi. Claudine, yes. Annette Sato, hi. Clarine Fernandez, good afternoon. Primo, yes. Sidhu, Bangalore, good afternoon. Minu Vijay, yes. Pravina, Akshay, good evening. Claudine, yes. Shobika, fair enough, fair enough. Arul Lakshmi, nice to see a lot of enthusiastic students in front of me. Okay, so which is quite nice to know. Right, Kalai, good evening. Savid Biju, good afternoon. Right. So all of you are doing well, yes? Right. Sidhu, good afternoon. Jismol, good evening. Rinsi, good evening. Athira, Sally, good afternoon. Jibi Wagis, good afternoon. Sonia D'Souza, good afternoon. Jismol, how am I? I'm doing good, Jismol. Thank you very much for asking. How about you? And all my other lovely students. Reha Vasapan, good afternoon. Rajita Rajan, good afternoon. Susan Machako, good afternoon. John, hi. Anija Devadatthan, good afternoon. Shiny VS, good afternoon. Lali Deepu, good afternoon. So nice to see all of you eagerly waiting. As soon as I clock in, you're all there. So what has Neetu's Academy in stores for you? We have an array of training that we give for all the linguistic exams, I would say, that you aspire for. Okay. Just small fine, thank you very much. Nice to know that you're all doing fine. Lali, good afternoon. Deepa Dinu, good afternoon. Arunima, good afternoon. Rani Ribu, good afternoon. Nice, lots of new names as well. So is there anybody who's attending the live for the very first time? Who's attending the live for the first time? Please do let me know. Just comment saying that I'm in, and where are you from? Rakendu, good afternoon. Rani Ribu, good afternoon. Simi, as always, I always remember now Simi from Qatar. But I love the way that she has been doing. Every time she comes and says, I am from Qatar. Because now it's very much embedded in me. Della Liban, hi. Kavita Balaji, good afternoon. Mabel Baiju, good evening. Kalei, good afternoon. I hope all of you, whoever have written the exam, have done excellent. Okay. Happy Pongal, Kalei. I know that you're there in Maldives, but still do enjoy. Make the most out of it. So, whomever, happy Pongal to all of you. Reshma Sajid, good afternoon. Vidya B, good afternoon. We've just pinned the social media platform, Neetu's Academy. We have WhatsApp channel, we have Telegram pages, we have a lot of other social media which is there. And I know that you're all there supporting us by either liking the page, following the page, subscribing the page. But if you have not yet, please do. That small nobility that we expect, because that's a support that we need. Katta support is what we have always got from you, and we expect that only. So please do like the page, please do subscribe the channel, please do follow the page. And also I would definitely request you to share the very same page that you're watching, the link that you're watching, so that that gives me an insight to know how am I coming into you. Okay, whatever that I do, are you feeling the benefit? Okay, Vidya, good afternoon. Renita, good afternoon. Right. So are you all ready for today's session? Now, before that, we're going to talk about the time. See, that's something that we always look into, isn't it? What's the thing about time that we look? See, time is most significant factor when you're doing with part A. And our challenge, our promise to all of you is always to make it into 8 minutes. Okay, 𝐿 is ready, Vidya is ready, 𝐁𝐼𝐴 is ready. Kavita Vijayan, good afternoon. So time is one of the most prominent things. See, in order to tackle time, okay, at times you have to really look into the aspect of what are the probabilities. See, maybe when you're doing the aspect of synonyms, okay, certain students still doesn't understand. They really like to go read. See, at times certain synonyms or the way that they have inferred there is quite challenging. Now, if you don't understand, okay, a student definitely lose track of time. Okay, because they're trying to somehow find or somehow associate an answer to whatever is needed. Okay. See, you have to have a broadened approach now. Okay, now why a broadened approach? See, you all have to really look into the aspect of broadening the approach. Say, just to give you an example, okay, let's say you've all gone for horse rides, isn't it? Horse rides, and you have seen the horses are given a blind kind. It's a bit blindfolded, not completely, but it only gives you a vision for the horse only to go straight. Okay, now that is because the horse, if it is not blindfolded, it looks in and it go haywire. Now this is where I'm bringing you today for that 8 minutes barrier. See, you have to have not a holistic view, you have to have a broader horizon when you're looking into, but even when you're looking into the keywords, you have to have a broadened vision onto it. See, let's say you don't know a word meaning, but when you concentrate on that particular word, do you think that you will find the meaning of the word? No way. But your brain has that innate ability for you to understand that particular meaning when you look around. Okay, so don't focus on that word. In order to tackle that thing in 8 minutes, you have to have a broader approach. A broader horizon is what you have to really do. Look around the world. You will definitely find the meaning. Try doing that, and you will not even find that you're wasting a lot of time finding to understand the meaning or comprehend the meaning of it. You don't have to, because your brain has that innate ability. You just have to utilize it, and definitely you will crack that 8 minutes. Okay, I missed a lot of good afternoon. Shittu, good afternoon. Najesh, good afternoon. Nimisha, good afternoon. Rintu, good afternoon. Beulah, good afternoon. Leader, good afternoon. Jilmi, good afternoon. So please do look around the words. You'll definitely get that time barrier. So I'm not gonna. Shakila Banu, good afternoon. After some time, Geeta Nair, good afternoon. How am I? I'm doing excellent, Shakila. Thank you very much. Shakila from Saudi, isn't it? Good, good, good. Still checking my memory if it's right or not. Now let's go into part B. Now we'll be talking about part B. Please, good afternoon. And part B, the question will be shared on the screen. As soon as the question pops up, do not waste your valuable time. We'll be only giving you 2 minutes, and the typo will be there in front of you. By God's grace, I cleared my exam. Shakila, absolutely good enough. Congratulations for your hard work. Because it is absolutely, so much of a catalyst. I love to see only great news is like this, and that you have been all, lovely students to only give us that. Because of your hard work, you're all there getting and making your dream a reality. So Shakila, thank you very much for coming and just telling this awesome news. I definitely would love to see. I'd love to know what are your scores as well, because that is an absolute moral booster for all my other students was there right in front of me, and they would also say, I'll also come and say, one day in front of all, I have made my dream. So take all the congratulations, Shakila. This is your time. Just more is saying, Shiny is saying. And the other is, do not worry, the material will be popping up on the screen, and one day you will also say, like what Shakila have done, that I've made to my dream. Rani, congrats. Take all those congratulations. You are in the limelight, Shakila. So congratulations for one of my lovely students. There you have the material on the screen. Please do the material and then we will discuss. Okay, time I've just alluded, but still a few congratulations to Shakila, Rakendu, congratulations, Reha Vasapan. I like the way that you have told. Congratulations, and I'm waiting for my turn to write these lines, and definitely you are going to come and tell me, Reha. Do not worry. Havita Balaji, congrats. Shakila Banu, reading, listening 350, speaking 360, and writing 300. Absolutely stunning. Go enjoy your lovely life, and you can. Shakila Banu have said thanks to all those lovely students who have made that. Congrats to her. Susan done, Jismol done, Shiny done, good enough, good enough. You're all multitaskers here. Very good. So you have all done on or before time. Priya Rakwal done, good enough. Now, would you be kind enough to tell me what is your answer and where you got that answer from? Rakendu done, Rani done, Kavita done, Deepa Dinu done, Kavita Vijayan done. Okay, good enough. Arunima done. Shine Johnson done. Reha done. Simi Qatar done. Soumya Sebastian done. Good enough. I love to see at least one icon next to your name. So that shows that you're all there, showing how much of an, so much of, what can you say, support that you are talking, when you're showing towards us is absolutely, what else could I say? Hats off to each one of you. Lali Deepu done, Soumya done, Rinita done, and Anija done. Now, what is your answer and where you got that answer? That is the next question. What is your answer and where you got that answer? That where is important. And as you can see, we have started our March, April, May admission. You can see how much of a trust our students have in us. They're all there thinking we can be that significant factor between you and your dream. And that's what we try to fulfill, your dream. Right, I'm still waiting. What is your answer? And where you got that answer from? That is the most important thing I'm looking for. I know that all of you have done. Now, what is your answer? And where you got that answer from? Tell me. Right, as students are going to tell me, the material will be popping up on the screen, and then I will discuss as when you write, I'll talk about the strategy. See, part B, you always have to remember, you have to read the question first. Okay, as you read the question, you're gonna underline the keywords in the question. See, students still doesn't understand what are keywords. See, keywords are words that is needed for you to understand what that question is. Those are called keywords. That's why I say it can be anything. Even if one word is a keyword, that's enough. If 2 words are needed, that is also there. If 3 words, that is also there. Okay, I have my first answers popping up. Sonia D'Souza, A from second para. Suzama, B from the end of the first para. Okay, fair enough. So I have A and B as the 2 answer options. Renita saying A. Good enough. How about others? I want all of you to come in. See, do not worry about whether it is right or not. See, your job as a student is to come and tell what you have got. And the sooner you correct your mistakes, the better for you in order to pursue your journey for your dream country. Shiny VS is saying B. Shine Johnson is saying A. Okay. Deepa, B from first para. Okay. So it is a mix of B and A now. Yeah. Good enough. Rashna is saying B. Beulah is saying A from first para. Reha is saying B last para. Okay. Rin Tujarin A from second para. Soumya Sebastian B from second para. See, this is why I'm telling you, you have to tell me where, because the same place you're getting both the answers, isn't it? So how we look into, and this is how they have designed the 3 options. All the 3 options can be a possibility if you really look into that particular way. Right, Soumya Sebastian B, second para. Now generally, as I've mentioned, I'm just going to dissect part B. So clearly the question is saying the guideline informs us that pregnancy testing. So guideline inform. So when this kind of question, especially in B, you have to relate it along with the question. So as that pregnancy testing is, the patient requires specialized treatment. So requires specialized treatment. Pregnancy testing is done when all other possibilities are exhausted. Okay, then the standard of product has been verified. Okay, I think there is a small glitch in the material. Okay, now let's see. The answer options are having a small glitch. I think there is some issue which has been okay. I think I'll have to I think there is some problem with the material. Okay, just give me a second, yeah. Let me take that because a small issue has happened, I think. Don't know what has happened. I'm very sorry for that inconvenience, yeah. Right. That is not the thing. So I'll just end this. Okay, don't worry about today's part B. I'm just gonna deal with that tomorrow. Okay, because that question had a small, it's combining some other answers. So that is not the question. So I'll be dealing with that tomorrow. So today we'll be talking only about part A. Okay, really sorry for that inconvenience. I don't know how that two questions have come up mixing into it. Okay, very sorry. So I don't want you to get a wrong thing. So really sorry, technical glitch, or maybe my error. Very sorry for that. Okay, so this question I'll be discussing tomorrow. Okay, do not worry. I'll not leave you empty-handed. Okay, so we'll be talking about part A. All of you have done part A today. What is today's material? I've told you very clearly it is paraneoplastic syndrome. Okay, so the material is very simple. Before going into, tell me how you felt about today's part A material and how many minutes you took to complete today's part A. Let's see how many of you have done that stipulated period of time. GB, yes, good enough. Shine Johnson, yes, thank you very much for understanding. Just small, 13 minutes. Okay, excellent. Good enough, good enough. Suzamma noted. Okay. Deepa Dinu, okay. Thank you. Thank you very much. This is what I said. You're all there. Of course, we know that there are times where errors do happen. But we're very confident that with you all supporting us like anything, we have no problem at all. Okay. So yes, how was today's part A material and how you felt about, how many minutes you have taken? The first one I have got is from Jismol, who said 13 minutes. How about others? How much time have you taken and how you felt about today's part A? Rabbi is saying 14 minutes, okay. Difficult, Renita, 15 minutes, okay, fair enough. So the heading, I like it. Now, it's first time when I was reading that material, I thought, what is this plastic and all those syndrome now? So paraneoplastic syndrome. Okay, these are all new insights for me, but I know that you're all well versed with that. Kavita Balaji is saying tricky. Okay. Fair enough, fair enough. Right, now let's go into part A. How are we going to do? See, part A, you always have to remember you only have 15 minutes to do part A, where you are expected to tackle 20 questions. Okay, and that 20 questions, that means if you really look into the time perspective, okay, see 45 seconds per question is what you are expected to find. So you need to have a right strategy. So the strategy is called skimming and scanning. Scanning, you know that it is to check detail. You know that you do scan. So skimming means you're going to quick look. So they say 1 to 2 minutes, but I would say 15 seconds per text. That means you will finish it about 1 minute because we have a target of 8 minutes. Understood? Now what are you to do? You're going to underline the keywords. Now, keywords are quite challenging because you should remember it by heart. So every time when you're doing part A, you should know what are the keywords that I've told you. Once it is there as a normal routine, then no problem for you. Okay. Now, before going into the question, so text part A, you have to skim through the text. Now, what are you to do? I'm just going to do skimming for you. Paraneoplastic syndrome is a set of signs, symptoms that occur when we have cancer. It's symptoms that are a malignant tumor and changes in the body are directly caused by the cancer. The tumor secretes a hormone and protein that affects body system, often with dependency. The immune system releases antibodies to destroy the tumor. During the process, the antibiotic damaging to the autoimmune. Paraneoplastic syndrome can affect multiple system organs, including the nervous system, endocrine system, kidney, bones, enter blood, immune system, parasitic. First signs of cancer, you may have middle age, older. You have lung, lymphatic, ovarian, breast cancer, same factors can increase the risk of developing. So done. Likewise, you'll have to skim through each text. See, this one, subheading is important, diagnosis. So all the diagnostic methods are given, isn't it? Now here therapy is to manage. So treatment to manage. So corticosteroids, immunosuppression, intravenous plasmapheresis, speech therapy. Epidemiology, causes. Now all the causes related, go to after this, you're going to go to the question. So you should know these 20 questions are divided into 3 types of questions. Okay, 1 to 7, these are called match the following question, where you are expected to write only any of these letters, A, B, C, or D. Okay, and you may use any of these letters more than once. Okay, now match the following. If you refer with the keywords 1 to 7, just in a jiffy you can do. Now I'll show you why. See, for example, medical interventions and substitutes, detrimental antibodies which are beneficial ones. So which are they going to decide? Detrimental means detrimental antibodies. So where are they talking about? It should definitely be in C, isn't it? Why C? So a procedure to replace antibodies. It's all saying, isn't it? Gives you a short healthy antibodies and destroy the harmful one. So answer is C. Sophisticated modalities employed in the detection. So detection where? Where is the ways that you're going to detection is through diagnosis. Modality different ways. So the answer is B, imaging technology, n number of different modalities. That's where you get the answer as B. Okay. Now, intricate factors that lead to the onset. So what are the factors that can initiate? So definitely it is there in A. Now, if you want to know what are the modalities that is going to cause, these are the causes. Now, what objectives underlie the performance of neurological examination? So where are they talking about neurological examination? It should be there under here, neurological exam. So the answer is B. Understood how keywords are being referred? Now, organs typically succumb to the effects of. So what are the organs that are more affected? Succumb means more prone to. So where are they talking about all these organs? Go to A, because it clearly says these are the things. Easy. This is how keyword will aid you. The preponderance, I love that word preponderance. What do you mean by preponderance? Prevalence of malignancy. So where are they talking about the prevalence? Go to D only, because that is where you're getting 10 to 15% to 20% of malignancy. That malignancy is a word which you can easily refer and identify it from D. Frequently employed pharmaceutical for diminishing. So pharmaceutical medicine. So where are they talking about medicine? C only. Now, are they talking anything about C? Reduce inflammation, swelling, corticosteroids. That's it. Understood? Good enough. Now go to the next set of questions. These are called short answer question, where the question number starts from 8 to 14. It can be a word, number or numbers, or both. Short phrase. Short phrase means you are expected to write 2 to 3 words. Shine Johnson, 7. Absolutely good enough. Keep it up. Now, even though the question type changes, the strategy doesn't change. Renita, 7. Which type? Kavita, 6. Good enough. Infrequently. So infrequently means rare. Now let's say I change that into infrequently or infrequent. 2 words. The whole meaning changes. Just small. Rashna, Priya, everybody, 7. Absolutely good enough. Encountered. So where are they talking about? It should be there somewhere in D, because neurological palenthroplastic syndromes are estimated to occur in fewer than 1% of patients with cancer. So which one is infrequent? Neurological. Neurological, because the balance is mentioned in the question. What does immunosuppression decrease in the body? So immunosuppression, go to C again. So immunosuppression decreases the body's immune response. IMMUNERESPONSE. Criteria that are yet to be reported as a causative factor. So criteria, what are that? Yet to be reported. That means which have made. So no race or sex predilection of palenthropologist syndromes is reported. So yet to be reported means with regards to race or sex. Those are the criteria. So race or sex have no thing on developing this particular disease. In a lumbar puncture, So lumbar puncture. Which fluid is tested for signs of antibodies? Now I don't know. I can't see lumbar puncture there anywhere. Is there anywhere mentioned lumbar puncture? Not necessary. But lumbar puncture is spinal tap. So now the next one. What is it? It is the test your cerebrospinal fluid. So 𝐶EREBROSPINALFLUID is the answer. Good enough. What is the term for removing harmful antibodies from plasma affecting healthy tissues? So what is the term? So definitely there again in C, a procedure that decreases the number of antibodies by removing plasma in your body and contains antibodies. So what is that? Plasmapheresis. PLASMAPHERESIS. Good enough. So what entity induces alteration in your body leading to symptoms unrelated to cancer? So something induces, that means it is the causative triggers. So which one should be there somewhere in? So what is the entity? So they're talking about syndrome. The symptom develop when a malignant tumor causes changes in your body and are indirectly caused by cancer. So the answer is malignant tumor. MALIGNANTTUMOR. Amongst which demographic, that means which people, is likelihood of developing paraneoplastic syndrome more pronounced, that means more prominent. So they are talking about, these are the people, middle-aged or older. So MIDDLE-AGED or older. So these are, again, see, if you think that it is 4 words, no, it is 2 to 3 words, because hyphenated word is one, or is another one, older is the next one. Good enough? So I have finished my next set. Now for the final set, which is called fill in the blanks question, which starts from 15 to 20, where the answer, how you answer is very similar to short answer question, but redundancy. You are expected not to repeat the word, even an article which is there next to the word. And you're only expected to fill what is missing. So it is estimated that dash of patients with cancer or less may manifest paraneoplastic syndrome. So definitely we have done that, isn't it? It is fewer than 1%. So the answer should be 1%, because, or less, fewer is already given. Okay. In let's say is already given. So this gives you a clue that the next word that is going to come should be a consonant sounded word. So in a dash, a needle is adeptly inserted into the lower back, extracting fluid and subsequent antibody testing. So the answer comes from B, because in a spinal tap, perform a test cerebral fluid and then it can be checked for antibodies. Good enough. So paraneoplastic syndromes affect multiple body system organs, including nervous system, kidney, bones, joints, and all those things. Where are they talking about? A. So the only thing which is missing is endocrine system. So the answer is endocrine system, which is a very straight answer. Question 18. You may be tasked that specific exercises to gauge alterations and prowess and dexterity. Now this is something which is of new word, isn't it? Prowess means strength. Dexterity means ability of a person to use body parts to perform a task. So where are they talking about? It's there somewhere in B, isn't it? So ability to use strength, coordination. So what is the only thing which is missing? The only thing that is missing is memory. MEMORY. Okay, memory is the answer. Now, in the domain of physical and speech therapy, elucidate intricate manners in which dash serve to enhance function like speech and movement. So definitely it's somewhere in C, isn't it? So what are they talking about? Muscle exercises that can help improve speech, and all things come from speech. So muscle exercises, MUSCLE EXERCISES. Utilizing dash, the healthcare provider can strategically eliminate the possibility of underlying condition contributing to symptoms. So where are they talking about? Again, something to do with B. So they're saying blood test can reveal suspicious findings. So the answer is blood test. BLOODTESTS. So I have wrapped my 20 answers. It's high time that you start telling me what are your answers. I mean, total scores. If you have any doubts with regards to any of those questions, please do not hesitate to clarify. Eagerly waiting for your either total score or if you have any doubts. Is there any doubts? Please do clarify. If not, do shoot. Shine 17. Good enough, good enough. How about others? Maria 19. Good enough, excellent. Keep it up. Renita 17. Good enough, good enough. 17 Susan. Good enough, good enough. Right, maybe because it's Monday, you're very reluctant to tell me the total scores or even to let me know, okay, if there is any doubt. Okay, no problem. Kavita 17, Rakendu 18, good enough. Renita, thank you. Okay, as you have started saying thank you. So it's high time that on behalf of Niku's family, I say thank you very much for giving us another opportunity and very sorry for that inconvenience caused. I'll definitely make it up for you. Okay, tomorrow I'll bring it up. We'll discuss the same thing. And Shakila was one other person who came and said that she has made to her dream. So that's it. So one day you all will come and tell us that we are all going to our dream country. So until and unless I meet you all tomorrow, adios from me. God bless you all. Take care. Stay blessed. Bye.